The medical aid agency Doctors Without Borders has extended a helping hand to those in need in temporary shelters. Now, for more on this, we're joined via Skype by Musa Ndlovu, the MSF's advocacy officer currently in Chatsworth in Durban in KwaZulu-Natal. Musa, a very good morning to you. And can you tell us how dire is the medical situation in the temporary shelters where you are?
The medical situation really is in a very terrible condition. There is a big number of highly pregnant women, and bringing together people here with different kind of infectious diseases, it becomes a problem, like TB. So when people are crowded together, there are a lot of opportunities that TB and other infectious diseases could be transmitted. And water and sanitation is a huge problem as well.
Now, what are some of the health and the medical emergencies that you do deal with on a daily basis there?
Together with the other partners, the other role players, like Red Cross, the Department of Health, and the volunteers, we are trying to address all those kind of issues. Since I mentioned that there are babies who are under 5, sleeping on the floor, it's not really healthy for them. What we do as MSF, we provide the plastic sheeting so that the sponges that they'll be using will be put on the plastic sheets to avoid moisture from the ground. We also provide the JoJo tanks to make sure that we supplement the availability of waters in different spots. Our mobile clinic as well has just come to assist. Right now, our mobile clinic is at Sipingo, where we are providing healthcare services, the vaccination of children under 5, paying attention to pregnant women, and also providing the health kits.
Mm-hmm. Now, for people whose treatment course has been, for instance, interrupted, such as TB and HIV patients, what kind of interventions have you got in place there?
Since we are working very close with the Department of Health, there are some cases that are to be handled by the Department of Health. But what we do, we identify those people through the registration and the assessment, and then, because we have the mobile as well from the Department of Health, we refer them to the mobile, and some are referred to the hospital, more especially for those who are seeking the chronic medication.
Mm-hmm. Now, children have been hardest hit, as you mentioned earlier, about the xenophobic attacks. What are some of the other challenges that the children are facing in attending to their particular medical needs?
When we look at the cleanliness of the place, as much as all the efforts are put in place to make sure that the place is clean, but when we look at the sanitary towels are lying all over the place. The children's napkins, which could cause problems, it's health hazardous. It could create some kind of problems related to health. So those are other areas that need much of attention in order to make sure that as much as people are crowded in here, but the hygienic kind of practices are taken into consideration.
How closely do you work currently with government from MSF's perspective?
We are working very closely because the meetings that are taking place almost every day are for planning in order to make sure that as we come in to bridge the gaps, we are able to know where exactly should we act and what is it that we could provide. Because, we are also trying to run from the duplication of the services that are provided. Because in an emergency situation, if you do not plan, you end up doing one and the same thing. Mm-hmm. With the other partners that are providing support.
Now, with the violence that has stopped currently, but there are a lot of people that is currently in the camps, I'm sure, would need some trauma counseling. Are you providing that as well? And how much does displaced people actually need once they reintegrate into their communities?
In all the camps, the people who are responsible for the trauma counseling and who are providing it, it's the social development, which is the government department, and also the Red Cross. They are providing psychosocial support. But when it comes to the reintegration to the community, we are still discussing that, and we want to make sure that the plan that is going to be put in place is the plan that will be a bottom-up approach, so that whoever is integrated to the community will get that kind of acceptance and welcome by the communities whom he or she will be staying with. Because if it is going to be a commitment only on a higher level, the problem will be on the ground. So in order to connect the commitment from the higher level and the commitment from the ground, we think that will be the proper way to deal with the situation in making sure that when they go back, they are they have the confidence that they will be treated well and they will be integrated into the communities and form part of the community.
From MSF, do you need any assistance from the public, from the communities around you? And if so, if people want to help, how do they go about doing that?
For now, what is crucial is to make sure that the camps doesn't last long. So the reintegration of the communities is a very important aspect of it. So the involvement of everyone, the communities, other civil society, the government is very much crucial. And all the other role players, the business people should come in as well in order to make sure that when we develop the plan together, led by the government, we all participate and we put our ideas together to make sure that the people are not forced into a situation where they cannot cope. But we come with amicable solutions through discussion and engagement.
But as things stand now, do you have it under control in that particular camp in Chatsworth?
Yes, right now, although it's crowded, but it looks like we are a bit having a control of the situation. But we still have to do more because people keep on pouring in. You cannot really confirm that the number that you have at that point in time will stay the same. In the evening or in the afternoon, you will find other people coming in again and adding in the numbers. So that becomes a problem on its own. So I can say, thus far, we are with all the partners making sure that the situation is under control through working together and making sure that we bridge the gaps as we are coming here to bridge the gaps. We bridge the gaps which we have identified, not only to identify the gaps and point it out, but not doing something.
Musa, thank you so much for your time and an update. That was Musa Ndlovu, the MSF's advocacy officer currently in Chatsworth.